right. Knock, knock, knock. My name is Siler. I'm going to be your nurse for the day. Is it okay if I do a physical assessment on you?
Yes.
Okay, I'm going to close the curtain. I'm going to wash my hands. Can I see your wristband, please?
Yes, Mom.
Okay. What is your name and date of birth?
My name is Ezzy Hart and my birthday is June 24.
Do you know where you're at right now?
Blandford Elementary?
Do you know what day it is?
No.
Do you know why you're here? Do you know who the president is?
No.
Okay. Client is ANO times 3. Speech is proper for age. Posture is erect. Hygiene is good. I'm going to touch you during this assessment. Is that okay? Okay, I'm going to wash my hands and pull the curtain. I don't know if I already said that.
You did.
Okay. I'm going to check your head now for any bumps or lesions. Stop, Izzy. No parasites, bumps, or lesions. Okay, close your eyes. Where am I touching? Tell me where I'm touching, Izzy. You gotta say it out loud. Izzy,
No.
close your eyes.
Cheek. Cheek. Chin.
Okay, cranial nerve 5 is intact. Close your eyes really hard for me. Open them. Puff your cheeks, smile. Cranial nerve 7 is intact. I'm going to check your eyes. Look at me. All right, cranial nerve 3 is intact. I'm going to do the confrontation test now. Look at this. Cranial nerve 2 is intact. All right, keep looking at this.
Okay.
Cranial nerves 3, 4, and 6 are intact. Stop acting that way or I'm going to have to redo this again. Okay, I'm going to check the mouth for any redness, swelling, bumps, or lesions. Stick out your tongue for me. Tongue is midline. Cranial nerve 12 is intact. Uvula rises with pronation. Cranial nerve 10 is intact. Do you have any difficulty swallowing? Okay, swallow. Swallow for me. Cranial nerve 9 is intact. Okay, I'm going to check your nose. Right, there is no mucus, lesions, or bumps, no deviation. Nose is midline. I'm going to check both of your ears. There is no excessive cerumen, bumps, lesions, or redness. Close your eyes for me. Where do you hear that? Close your eyes. All right.
Both.
Okay. Cranial nerve 8 is intact.
How are you doing that?
Shrug your shoulders for me. Okay. Push your head against resistance. All right. Cranial nerve 11 is intact. I'm going to palpate all your lymph nodes to see if there's any tenderness or swelling. This is submental, submandibular, tonsillar, deep cervical, posterior cervical, supraclavicular, preauricular, posterior auricular, and occipital. Okay, go ahead and lay down on your stomach for me. I'm going to inspect the thorax for size and shape. Thorax is +1. I'm checking for spinal alignment as well. The spinal is aligned. Stop. The spinal is aligned and straight. I'm going to palpate the costovertebral angle for any tenderness. Does this hurt?
No.
Does this hurt?
No.
Right. I'm going to listen for the lung sounds posteriorly in at least 8 spots. Breathe in and out, 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 in and out. Okay. So breathe in and out for me. I'm watching for a thoracic expansion. Go ahead and sit up for me again. Okay. I'm going to palpate the carotid artery on each side for at least a minute. Okay, good. I'm going to listen.
Do you want me to take off now?
No, you can keep them on. I'm going to listen for any bruits, so go ahead and exhale for me. And then hold your breath. Good. Exhale, then hold your breath. Good. Right. I'm also assessing respiration for, is he not right now? I'm assessing respiration to see if there's any labored breathing, any use of accessory muscles, and any cough. There's no cough, there's no use of accessory muscles. I'm going to listen to the lungs anteriorly now in at least 8 spots. In and out, 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 in and out. And I'm going to listen to at least 2 spots on the side in the axillary. Alright. Good. I'm going to listen to the heart sounds now. So I'm going to listen to the aortic, which is the right sternal border, the second intercostal space. Pulmonary, which is the left sternal border, second intercostal space. Erb's point, third intercostal space, left sternal border. Tricuspid, which is the fourth intercostal space, left sternal border. And then the mitral, which is the fifth intercostal space, mid-clavicular line. So go ahead and lay back on your stomach for me. I want you to say 99 each time I touch your back.
99, 99, 99, 99.
Good job. Okay, sit back up for me. I'm going to listen to the vowel sounds in each 4 quadrants. I would do this for 1 minute each if I didn't hear any, for 1 minute each, and then if I didn't hear anything, 5 minutes max. All right, how often do you use the bathroom? How often do you use the bathroom a day?
I use it all the time.
Do you poop every day?
No.
When is the last time that you pooped?
I don't know what day it was.
Okay, so bowels are not regular. I'm going to now assess for any edema on the extremities, any swelling or bruises. Looks like the client has a small skin tear. No edema or swelling. I'm going to now assess for capillary refill in the fingers. And I'm also going to do the same in the toes. Good. Capillary refill is less than 2 seconds. Thank you. Okay, go ahead and stand up for me. Walk. And then walk back to me. Okay, stand completely still. Close your eyes. Stand away from the couch. Completely still, close your eyes. Close your eyes, arms down to your side. Okay, Romberg is negative, no sway. Sit back, down. Actually, stand back up. All right, head side to side. Put your head side to side. You can look at me so you can see what to do. Put your head side to side. Up and down. Arms in a circle. All right, legs out, over, side. Good job. Okay, range of motion is intact.
There's bananas on the ground.
Okay, now I'm going to assess the strength of the extremities. All right, push against my hands. Push against my hands. All right, push against my hands with your hands. Izzy. Push against my hands with your hands. All right, push against my, all right, push against, push against, push against. Okay, the extremities are strong. Okay, now I'm going to test the reflexes. So I'm going to distract the patient while I'm doing this, of course. Test the triceps, biceps, brachioradialis, popliteal, dorsalis patalis, and plantar. I'm going to do a backwards J on the foot. Okay, and that is negative Babinski. Backwards J on the foot, negative Babinski. I would do that on both sides each time. So now I'm going to palpate the pulses. So I'm going to check the brachial. I'm going to check the radial. I'm going to check the popliteal. I'm going to check the dorsalis patalis and the tibial, posterior tibial, and then the dorsalis patalis. And I'm testing that on both sides for rate and strength. Stop. Not right now. I believe that is it. So do you need anything? Are you comfortable right now? I'm going to ensure my client is comfortable and give her all her belongings. I'm going to wash my hands, open the curtain, and go document my findings.